And for this Thursday morning, May the 12th, we welcome in via the Zoom connection, Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome to Wellspring, a live broadcast sponsored by Spectrum Health Zeeland Community Hospital. Spectrum Health is committed to improving the health of the community. That's why Zeeland Community Hospital partners with Healthy Ottawa to complete a community health needs assessment. Joining me via Zoom to provide more details on the assessment and how the hospital is responding to the information is Amber TerHaar, who is the manager of Regional Community Health at Zeeland Community Hospital. Good morning, Amber.
Good morning, Sara.
And we are joining you via Zoom today because we knew the traffic in Holland with tulip time was going to be really busy, and we wanted to make certain we got here in time. So if you do have a question, you can call Gary at 616-395-1450. That's 616-395-1450. And Gary will pass along the questions to us. So Amber, what is your role at Zeeland Community Hospital?
Yeah, thanks. So I have the privilege of managing the community health programs. And what that entails is we have childbirth and parenting programs, we have support groups, we do suicide prevention work, we have dietitians that do some nutrition work and weight management work. We have a lot of programs that occur in the schools. We also have first aid, CPR, senior classes. So a very large umbrella, but then underneath that, it also incorporates work around the community health needs assessment.
So before we talk about the community health needs assessment, Amber, I just want to know, first of all, how long have you been with the hospital and what do you enjoy about your work?
Oh, I've been there a long time. I think it's 21 years. So we're going to move from that very quickly because it's amazing how quickly 21 years can go. It just doesn't feel right. So I love it because what we are doing is trying to make sure that what we are offering in the community and the work that we are doing in the community is meaningful, but also impactful. We truly do want to improve the health of the communities we serve. Sara, you said that well in your introduction. And so we want to make sure that we're doing that with our interventions. And when we see that we indeed are, it's exciting and it keeps me really fired up for what I do.
To do it 21 more years, right?
Right.
So what is the community health needs assessment and what is its purpose?
Yeah, so the community health needs assessment is truly just getting an idea on the health status of our county. So it's done in Ottawa County, and we really try and do a broad brush of general community, making sure we get the underserved. We elicit feedback from key informants and key stakeholders in our community as well, stating, what do you see in your line of work, in your areas of influence of the largest areas of concern in our county. And then we do the formal assessment as well. And then we put all that data together in this wonderful, very lengthy, but really great, meaty report. And we look for trends and we look and say, okay, what are our biggest concerns and what as a community are our challenges and barriers? What's kind of bubbling on the top of health issues that we need to address?
So share with us some of the key data points from this assessment and what that means for our community.
Yeah, so, there's a lot of information that can be held in this assessment. So what we try to do is just really look for like the key areas, the largest concerning points, because we can't address everything. We wish we could, but we can't. We want to make sure, where are we going to have the most impact? Where does it make sense? But where's the data driving us? And there's 3 areas that we really saw as key significant areas in our county, and that falls under mental health, access to care, and obesity. And with mental health, 3 times as many youths have thought about suicide and 2 times as many have attempted since we did this assessment back in 2017. So that's a 3-year span, and that's quite a bit of an increase in youth thinking about suicide, but then also attempting, which just is heartbreaking. And so we knew as an organization and as a community with the health department, we needed to put that down as a significant health need. The second one is access to care. And the data point that spoke to us is 1 in 8 adults in Ottawa County have no personal health care provider or medical home. And this proportion is even larger for the underserved adults. So you think of our migrant community, for instance, it is just extremely larger there, where they don't have a medical home and they don't have a personal care provider. And then the third one, under obesity, over 12% of Ottawa County youth are obese. And this is not overweight. There's a difference between overweight and obese, but they fall under the obese category. And that also is an increase from 2017. So those areas really bubble to the top. And we're focusing on them and hoping to make an impact.
My guest is Amber TerHaar, and she is the manager of regional community health at Zeeland Community Hospital. We are talking about the community health needs assessment, what its purpose is, what's some of the information that is housed in that, and then how Zeeland Community Hospital is addressing those needs. You know, what's I think so really exciting about this community health needs assessment, it is a collaborative, because when you think about the data that we're getting, it's data for Ottawa County, correct?
That is correct. Yep, very specific to our county. Yes.
Right. So what organizations are involved with the work?
Sure. So the Ottawa Department of Public Health really drives the work. And then the other individuals that are around the tables, us, Spectrum Health Zeeland, the Holland Hospital representatives, North Ottawa, Community Mental Health, and then Community Spoke and United Way are also around the table. And so it's truly it's a great working group. We work well together. But then when we share data and when we speak into, okay, now how do we respond? We certainly open that invitation to anybody in the community that wants to come and learn more and also speak into what they see as some areas that we can make an impact.
So Spectrum Health is committed to improving the health of our community. I mean, we take care of people when they're sick, but I mean, if we can get ahead in some of these areas. So, people have a primary care physician, so they don't have to use the ER urgent care, even though those places are available. Can you share how the hospital is responding to the assessment data? So you take it and then you need to develop a plan.
Right. And that is called the implementation strategy. And it's really kind of exciting work, because we do take the community board, members of our medical executive committee, community partners, and Spectrum Health leadership are all part of this large conversation on looking at the data, truly doing a deep dive in that data. And then we come back and say, okay, where do we see the key significant findings, which we talked about, those 3 areas. But then now we have to kind of decide objectives under each significant health need. And then what guides us there is just the recommendations from those partners for sure, but also feasibility, impact, allocation of resources, and if there are similar strategies being done in this community. And then, so it takes us a while. There's quite a few meetings. The hospital board is really engaged in that. And we just, like I said, we take a deep dive. We throw a lot up on the table or up on the wall, and we take some sticky dots, and we're like, where do we see what are we voting on that we think that maybe we have the right partners around the table to really make sure that we're moving the needle. And then from there, we have an implementation strategy. And that document is really our commitment back to the community that says, we heard you. And now this is how we are responding. And we feel like we are bringing our best to the table with this plan.
Okay, so you mentioned that there were 3 areas that rose to the top: mental health, access to care, and obesity. So like you said, you put all of that up on a wall, but you have to funnel it down, and you need to say, okay, how can we impact in these areas? So can you provide some examples of program outreach? Let's first talk about mental health, because, when we think about youth, thinking about suicide and then attempting it, our hearts just break.
Yeah. Oh, absolutely. It's critical that we do what we can to help these youths and to lessen the attempts, thinking of it. Yeah, it's a very heart-wrenching topic. So what we have is the School Blue Envelope Program is what it's called. And it is a suicide prevention program. Is really geared for middle and high schools. It uses evidence-based tools to really gauge the level of severity. Staff are trained on how to recognize students that may be struggling and then how to approach them. It does include an action plan. Parents are pulled in. And then in this training, it's just really impressive how from one training staff go from not feeling very confident to responding to a student in need to increasing their confidence and just having those tools to say, I have some concerns. How do I even start this conversation with a student? And then if they truly are founding concerns, how do we move forward and keep this student safe? So that is one that we were doing. And then the other one is mental health first aid. And that is a training. If you think of like first aid CPR, this is very much a very similar class, but it's around mental health crises, how to notice it, and then what to do in those situations. So we're doing more under mental health, but those are top two in our implementation strategy that we are bringing back to our community.
Okay, so I have a question though, Amber. Why is it called blue envelope? People may be thinking
that is a good question. So it was actually originated and developed in our clinical spaces, and it's just a kind of a code word on hey, we have a concern, versus saying, hey, we have somebody here that we think may be struggling with suicide, attempting or thinking of suicide or just some mental health crises. Saying a blue envelope is a way to safely and very discreetly say we have some concerns. And again, the staff are trained, so it is a very discreet way to say, alert, we have some concerns here, without everybody in earshot really knowing what those concerns are.
Well, it's exciting to think about, because you think about our teachers and our educators, they're interacting with these kids on a daily basis. And for them to be able to have those tools, and then, as you say, know how to elevate it if, they hear that. So thanks for all of your work with the Blue Envelope program. Okay, so that was one of the major issues that arose. Another one is access to care. Talk about what are you doing with that?
Yeah, so access to care is really it's really those who have and those who have not. Those who have the ability to access services and resources, and those do not. And so what we are doing in that area is we do have an Ottawa Pathways to Better Health community health worker program. It's a big word, but really we utilize community health workers in the community and we walk alongside, these community health workers walk alongside those individuals that may not have resources or able to, maybe transportation is a barrier for them, to access our services. And we walk alongside and really help them break down those barriers and challenges so that it's easier for them to get the care that they need. So that is one, we've been doing that one for a couple of years and it's been so successful. We are continuing with that one.
So where could people get more information about the Ottawa County Pathways program?
Yeah, so that is right on the Public Health Department website, and they can also just Google the Ottawa County Pathways to Better Health, and there's a lot of information on there, the criteria, but also how many health workers there are, and some testimonials, which are really inspiring to read.
We have about a minute left. Obesity. What are you doing to address that issue?
So the one I'm going to talk about, we have a lot that's going on underneath this one too, but it's called the CATCH program, and it's the Coordinated Approach to Child Health. It is evidence-based and it is endorsed by the CDC, and we are bringing that to schools, and it's really about policy and environmental change in these schools, encouraging healthy eating, encouraging physical activity. It's a great collaboration, and we are expanding that program, and we're excited to do so.
So Amber, one last comment. How do you know if you're making a difference?
Yeah, that's the big one. And we set up these objectives and we measure. We measure effectiveness by evaluating, making sure that policies are changing, and that we have these tight partnerships with these organizations that we can come back and forth and say, hey, what are you seeing? What behavior changes are you seeing? But then also going back to the data that we are measuring. And we measure that on a continual basis to make sure we truly are making an impact.
Thanks, Amber, for what you're doing. Until next week, Spectrum Health Zeeland Community Hospital wishes you well.